Good evening, everyone. I'm Tony Segreto, and once again, proud and honored to be your moderator for tonight's In the Know Town Hall. We welcome you to the second town hall in our series that we call The Science of Aging. Now, last month, many of you joined us for our talk on protecting your brain health. But tonight, we have something different for you. We're going to focus on our skin, specifically ways to protect our skin as we go and as we age, new treatments for disorders and disease of the skin, and ways to keep our skin looking healthy and beautiful. And as someone who has lived in the South Florida sun for many, many years, it is something I know I'm interested in, and I'm sure many of you are as well. As one of the largest organs in our body, the skin is our first defense against many ailments, and so it's critically important to keep it protected. And tonight, we're going to underscore this because it's so important. We have brilliant, and I stress brilliant minds from Sylvester Comprehensive Cancer Center and the Dr. Philip Frost Department of Dermatology and Cutaneous Surgery that will help us explore skin care and skin cures. They will share not only an overview of how the skin ages, but also methods for prevention and early detection of skin disorders. Our panelists tonight include some of the most prominent experts in dermatology and skin cancer. Dr. Robert Kirschner, chair of the Dr. Philip Frost Department of Dermatology and Cutaneous Surgery. And Dr. Kirschner is an expert in wound healing. He will take part in the question and answer session tonight, along with Dr. Natalia Jaimes, who specializes in the early detection and prevention and treatment of melanoma. Dr. Jennifer Tang, who specializes in non-melanoma skin cancers. We will also discuss cosmetic and aesthetic dermatology to combat the aging process. Dr. Sasha Hu and Dr. Stephen Mandy are both here to share the latest on anti-aging skin rejuvenation techniques and all those techniques that we see every single day. As you can see, it is truly a world-class group of experts. Now, before we get started, let's go over how you can participate in tonight's conversation. After Dr. Kirschner has delivered his opening remarks, all panelists will answer the questions that you've submitted over the last few days. But you will also have the opportunity to submit questions during the program tonight. For those of you who have joined us before, you know the drill. For those of you who are new to our program, here's what it takes. On the bottom of your screen, you'll see the Q&A feature. All you have to do is submit your questions. Every single question will be anonymous, and we will get to as many of them as we possibly can. So without further wasting any time, because it's important to get all these doctors talking about this really important subject, it's my pleasure to introduce Dr. Robert Kirschner. And Dr. Kirschner, we are so honored that you could take the time and be with us tonight, and we are excited that you and your colleagues will be joining us.
Thank you, Tony, and good evening. Really, I'm excited also about being here. I want to talk about our favorite subject, skin and skin diseases and skin treatment. And I'm thrilled to be amongst the audience tonight, and also my great colleagues at the Department of the Dr. Philip Frost Department of Dermatology and Cutaneous Surgery. I want to start by telling you a little bit about the department, giving a little history about our great department. Founded 65 years ago, our department has become one of the top dermatology departments, not only in the United States, but in the entire world. We're renowned for innovation, discovery, treating patients, scientific advancements, and developing leaders. And just 2 years ago, or actually last year in 2019, we named our department the Dr. Philip Frost Department of Dermatology and Cutaneous Surgery. This is really special because it honored Dr. Philip Frost, who is a dermatologist, a renowned dermatologist, who not only trained at University of Miami Jackson Memorial Hospital, but was on faculty for 6 years as a professor. Dr. Frost went on to great business acclaim and tremendous success. And in addition to his renown as a dermatologist and as a businessman, also is one of South Florida's great philanthropists. And his support of our department has really empowered us to do things that we're going to share tonight, and things that we continue to do to advance care in the coming years. But as excited as I am about the legacy of the department, I'm really equally, even more excited about our department today. We, on a daily basis, take care of patients, advance care, to teach the next generation of leaders in dermatology and advance the science across the spectrum of skin diseases. We have world experts in skin cancer, wound healing, itch, psoriasis, skin rejuvenation, among others. And the people that we've assembled today represent that great leadership and are great experts in our department. So I'm tremendously excited about what this evening holds for us. We're blessed to have the opportunity to share our knowledge with you today, and look forward to the answering some of the great questions that are coming at us. So Tony, back to you.
Dr. Kirschner, thank you so much. And that leads us into the Q&A portion of our event tonight. So let's turn to our very first question. And Dr. Kirschner, this is for you, so you're going to kick it off. Given the array of things your department sees and treats, what are the most exciting developments happening in dermatology right now?
Oh my, well, as hopefully you'll see from all of us, we're quite passionate about about dermatology. But I think that the thing that's most exciting about what's happening in dermatology today is that we're bridging advances in the lab and in research and translating them to patient care. We're taking novel innovations about personalized medicine, directed therapies, specific for patients and their diseases, and now we're able to apply them to the care of care of patients. And what's very special about the skin is that it's so accessible. Certainly patients feel very comfortable with their skin. They see it every morning. When they have a problem with their skin, it's really important to them. But also we can sample it, we can test it. And advances in stem cells, gene therapy, we'll talk about rejuvenation and aging and senescence. We're able to study the skin, and it has impact not only on the skin, but as the body of the whole. And I think those type of opportunities really represent one of the things I'm most excited about in dermatology today.
Thank you, Dr. Kirschner. Dr. Tang, welcome. The question's for you. Why is skin cancer detection important, and how can I recognize signs and symptoms?
Hi, Tony. So skin cancer as a whole is the most common malignancy both in the US and worldwide. The American Cancer Society estimates that there will be over 5 million cases of non-melanoma skin cancer diagnosed in 2020, and upwards of 100,000 cases of melanoma as well. And for that matter, so it has morbidity in terms of up to 7,000 people will die of melanoma of those cases. And it's the 5th most costly cancer to treat overall. And the incidence is rising, probably due to aging, trends in the population, overall cumulative sun exposure through the years, and also the concept of immunosenescence, meaning as we age, our immune system wanes in protecting against UV-induced damage. And for the most part, I'd recommend looking out for anything new, changing, or unusual on the skin. The most easy anecdote to recall is the ugly duckling sign, meaning to look for the outlier lesion that doesn't belong in the skin, and either seeing any member of the department or primary care physician, and when that's detected.
Dr. Tang, thank you. Dr. Jaimes, welcome. I already had a skin cancer. Is there anything I should do to prevent or detect new skin cancers early on?
Hi, good evening, Tony. Very happy to be here tonight. It's really an honor and a great pleasure to share with all of you our what we do and what Dr. Kirschner said we are passionate about, and very nice to really share with everyone. So basically, after anyone has first skin cancer, there is the risk of having a second one So important, very important to self-skin exam. So what Dr. Tang already mentioned, so check your skin at home once a month. Anything new or changing, that's what we want to see. And new is anything that comes, was not there, and stays for more than 3 or 4 weeks, then you should call that to the attention to your physician, your dermatologist, and or anything new or anything changing. And change is anything. I mean, it was flat, it's getting raised, changing shape, color, form. And as you see, I didn't really mention color, so it could be pink, brown, or black. So that's important from the patient's end, sun protection, and obviously be in surveillance with your dermatologist. And the frequency will change. It could be every 3 months, 6 months, or at least once a year. So basically, it's being on top. And if anything is going to come again, then we want to really detect it early, where the scars are going to be minimal and there is a lot of things to do.
Dr. James, we're going to stay with you because we just had this question submitted and it kind of goes with what you were just talking about. And the question goes like this. I've had a routine checkup for skin cancer where the physician does it in person. Are there alternatives to this checkup that involve technology? For example, a scan of the skin that would detect possible skin cancer, whether basal cell or a melanoma?
That's a great question and very pertinent for our reality. A lot of imaging techniques now that we have. And so there are many things that we can do. I don't know if exactly the question was geared toward telehealth. But I guess probably I'm going to just talk about what we do. So when the patient goes in person and is under surveillance, we have different imaging techniques, including what we call total body photos or photography, mold mapping, same name, where we just make baseline images of the patient, clinical and with technique that is called dermoscopy. So we are able to track the patient in time and really detect things that are very early, that you can see them before your naked eye can see it. So that's how we take advantage of the technology. There are systems that are have also the aid of artificial intelligence and help us detect new things. So yes, there is a lot of ongoing on that.
That was a great question. Dr. Hu, welcome. We look forward to hearing you tonight. I already had a skin cancer, I am interested in getting cosmetic injections. Which procedure should I start with, Dr. Hu?
Hi, Tony. Thanks for moderating for us. That's a great question, but I do want to preface by saying skin rejuvenation should really come after skin health. So as my colleagues, Dr. Jaime and Dr. Tay and Dr. Kirschner were talking about a little bit earlier, skin health is really the most important part of dermatology. We want to really encourage everyone to get a full body skin check by a board certified dermatologist more frequently if you have had a history of skin cancer or other risk factors. So after you have taken care of your skin health, a lot of times people now start thinking about skin rejuvenation, looking younger, feeling the same as how they want to also look externally. So in terms of procedures, we often start with very easy procedures such as Botox or Dysport or other muscle relaxers. We can also talk about volumizers to correct deeper lines and shadows. There are laser treatments, chemical peels, the list goes on and on. So ideally, we should really do a face-to-face consultation where I or my colleagues will evaluate your needs, evaluate your health, evaluate what really bothers you. And then we can make a plan. So truthfully, the best treatment is part of a maintenance, at least a 2-year or 3-year plan, not just like a one-time deal. Because honestly, the best results are achieved when we have a roadmap.
Dr. Hu, thank you so much. That was a great answer. Dr. Mandy, welcome. It's nice to see you, sir. What are realistic expectations for cosmetic dermatologic procedures?
Of course, we're hoping to stretch those out, but the realistic expectation, and there's been a great deal of science involved in this, is approximately expecting if you do all of the things or some of the things that Dr. Who spoke about, perhaps a 5 to 7 year improvement in your normal stated age. So if someone comes in at 50, it's very likely if they do, say, Botox and a filler and maybe a laser treatment, they'll look 5 years younger than their apparent peer group. We'd all like to look 15 years younger than our peer group, but that doesn't happen. And it's always funny. I'm sure Sasha experiences the same thing. People come in with a picture of themselves as a 25-year-old. They say, I want to look like this. Well, that's a little less than realistic, but I think aging faces is it's our brand. That's what we are. And people see it every morning when they get up. And it becomes, it's who we are. So if we can make it look 5 years younger and healthier and more vibrant and more vital, then we've accomplished a lot. And that's the realistic expectation.
Well, so much for my 25-year-old picture. I guess I better put it away, Dr. Mandy. But that's great advice. And the realistic part of it is really important here. Dr. Kirschner, is there anything new to help heal or remove a scar?
Yeah, Tony. So it turns out that in theory, we don't have to scar. In utero, if you wound a fetus in utero with surgery, they don't scar. So we have the knowledge in our bodies to prevent scarring. But then when we're born, we start to scar. So the long-term goal is to try to replicate what happens in utero and have scarless healing. Well, we're not there yet. Hopefully with scientific advances in our department and other places, we'll get there. But when you have a scar, we have many technologies to try to prevent and then reduce it. There are physical devices to release the mechanical tension, and even things like Botox releases the tension and prevents spreading of scars. There are dressings that have been developed to prevent the spreading of the scars. There are lasers, and I'll ask Dr. Who or Dr. Mandy to mention some of these lasers that can be used on a scar to improve the appearance of the scar once it's there. And then we can inject certain medications, anti-inflammatory and anti-fibrotic medications, such as steroids and chemotherapeutic agents to lessen the scar. So we have at our disposal now an armamentarium of things, but the hope is that someday we'll have even better tools to prevent scarring.
Dr. Kirschner, thank you so much. Dr. Tang, what are novel treatments for advanced skin cancers now?
It's a great question, Tony. So, and there have been a lot of strides in the advancement of the treatment of advanced and unresectable skin cancers. For basal cell carcinoma, which is the most common malignancy of them all, almost 10 years ago, there was the development of a specific targeted therapy blocking a pathway that's very commonly mutated in basal cell skin cancers. But again, this is typically reserved for ones that are unresectable or have metastasized, meaning have spread elsewhere to the body. And then in the realm of melanoma, there have been also additional targeted therapies and also the concept of immunotherapy, which is utilizing the immune system to fight the cancer cells. And then on that same, in that same lane, we've been using immunotherapy, going backwards to treat non-melanoma skin cancers as well. About 2 years ago, there was the first immunotherapy agent that was FDA approved for the treatment of advanced and unresectable squamous cell carcinoma with a great response rate, and it's been an increasing trend and great area of research for us at Sylvester, and it's a very exciting time where hopefully we can decrease the mortality of this small subset of patients that that are not treated with our local therapies in the office.
Dr. Tang, stay there because we just had this question submitted. So let's expand what you were just talking about. And the question goes, are there alternatives to surgical removal of basal cell, and can lasers be used?
That's a great question. This is I'm speaking off-label, but there are studies and publications out there. It's in the very, very early stages. There've been lasers have been utilized to treat very thin basal cell skin cancers off the head and neck, meaning in areas that are of lower stakes. And it's a laser that targets blood vessels specifically, because the rationale is that in basal cell skin cancer, you have a dilated blood vessel that's feeding the tumor. And the mechanism of action is, presumably that we're ablating and getting rid of that large feeder vessel. But again, this is very off-label, and a lot of speaking on the regarding scars, because it's such a, skin cancer is such a prevalent disease, we are hopefully, moving in the right direction and looking towards, more cosmetically acceptable alternatives aside from surgery.
I just want to echo Dr. Tang's comment. We do have the laser at our university. We have used on a few patients with very good success rate. However, it's really for patients who cannot be or cannot tolerate or not really good surgical candidates, or for other proven more effective treatment. So laser therapy is possible. For further questions, feel free to reach our department. We can definitely give you more feedback in person.
Thank you both, Dr. Tang and Dr. Hu. And Dr. Hu, while I have you here, this one was submitted a couple of days ago, and I'll add on to it. But the question is, what type of sunscreen is best? And quite frankly, we are inundated with all these different sunscreens when you walk into a drugstore, even a supermarket, from levels of different protection. Please tell us what's the best for everyone.
That's a great question. I get asked that almost every single day. The truthful answer is that the best sunscreen is the one that you're most likely to use every single day. So sunscreen, cosmetic appearance, and also how it feels on the skin is very important. But honestly, as long as your sunscreen is SPF 30 or higher, has a broad coverage of UVA and UVB, and you are not only using the adequate amount, but also reapplying often, ideally every couple hours if you're going to be outdoors, or at least twice a day if you're driving a lot, if you are getting a lot of indirect exposure. So sunscreen matters, reapplication matters, the number matters, but honestly, at the end of the day, is whether you put it on or not.
Well put. But we're going to keep you here, Dr. Hu, because we just had this question submitted here. And it goes like this: Korean sunblocks have more PA, while the USA hasn't approved a new sunscreen since 1999. So we are really behind. Additionally, USA sunscreens are not cosmetically elegant, thus discouraging daily use. I want to know your thoughts.
So whoever asked the question is very knowledgeable. So it is true that FDA always is a little bit more conservative compared to other regulatory agencies in Europe, Australia, and also Asia countries. So that being said, it's not that difficult to find a sunscreen that's suitable for your skin. Most problem when people experience in terms of sunscreen is actually the preservatives, other additives, in addition to the active ingredients. So we do have a list of sunscreens that we as dermatologists prefer, have found good tolerability in our patients. But in terms of active ingredients, I know that there are a few, such as Mexerol, Tenasorb, are ingredients that are very effective against UVA and UVB, that are proven, they're like approved and available in Europe, but not so much in the US. But I would say don't let that be a factor of not using sunscreen. There will be a sunscreen that's good for your skin type. Just be patient. Typically, I highly recommend looking for sunscreen that's just sunscreen. Don't forget about sunscreen with moisturizer. Forget about tinted sunscreen for anti-aging. Focus on sunscreen meant for sunscreen and some for protecting your skin. And then secondly, look for fragrance-free. And then thirdly, look at the ingredient list. Make sure it doesn't have a lot of filler ingredients, preservatives.
Great. Dr. Hu, thank you so much for that. Dr. Mandy, how much weight will I lose with liposuction or cool sculpting?
I think the most important thing is to recognize that liposculpture, whether it's with cool sculpting or with liposuction, is not really a weight loss procedure. It's a contouring procedure. And what we're trying to do is to remove fat from areas that interfere with the total body appearance. So areas like the waist, the side of the thighs, the knees, areas that look out of proportion, we try to put back in proportion. By law, we are limited to the amount of fat we can remove in a single procedure. So generally speaking, the most one could expect to remove, say in the state of Florida, would be somewhere around 4 to 6 pounds, and that would be probably not making a lot of impression on a scale, but it makes a dramatic impression in clothing.
Dr. Mandy, thank you. We're going to keep you here because this was just submitted. Are there any topical creams that really work for diminishing dark spots? And which active ingredient should I look for?
The dark spots is a very broad word. I mean, a mole, for instance, is a dark spot and it won't go away with a cream. But the spots that occur with aging, many of them will respond to either retinoids, which would is a vitamin A derivative, or to a medication like hydroquinone. Hydroquinone is available over the counter in a 2% concentration and by prescription in a 4 or greater percent concentration, and it works very well in many patients who have dark spots or who have what we call melasma, pigmentation associated with hormones in pregnancy. We also use, Dr. Hu was just talking about, we also use lasers a great deal to diminish or remove brown spots that are age-related and or sun-related.
I want to just expand on Dr. Mandy's answer. There are a few ingredients I like to talk about to my patients, in addition to topical retinoids, SPF. So kojic acid, lactic acid, niacinamide, azelaic acid, lately arbutin, as well as topical tranexamic acid are all very encouraging and safe, effective ingredients or alternative to hydroquinone, because we all know as dermatologists that even with over-the-counter hydroquinone long-term usage, you may get what we call ochronosis, which is a paradoxical hyperpigmentation that you definitely don't want to get into. And then lastly, if a dark spot, if a brown spot does not get better, please see one of us, because we definitely don't want to miss a skin cancer.
The other thing I think it's important, Sasha, to add what you just said, nothing that we have will make dark spots go away if you don't use sunscreen.
Well put, both Dr. Mandy and Dr. Hu. Thank you. Dr. Jaimes, what is the best way to protect ourselves from sunlight?
So I think I'm going just to summarize what has been done and had been said. Basically, sunscreens, when you say sun protection, probably many of your first thought is sunscreen, the creams. And that's, I think it has already been talked about, use broad spectrum, at least 30 for the daily activities. But if you're going to be outside, probably you want a higher SPF. Water resistant, reapply every 2 hours. But we need to remember that it's not only the sunscreen, that we only need to seek the shade, to wear the hats with white brim, the sunglasses that are good sunglasses that really protects us from the sun for the eye and all around the skin, around the eyes, and the sun protective clothing. So there are very nice styles and colors and that really help us with that. So don't only use this sunscreen, but also the other things, the physical protection is also very important.
Dr. Jaimes, does it matter the amount of time you spend outside? If you're only going to be outside for 20 minutes, do you still need to put sunscreen on? Obviously, if it's for longer, you should.
Right. So in theory, you'll hear from, I would say, most of the dermatologists that use it as a routine. So it will be the thing that you will put on your morning, and obviously depends also in the time that you're going to be outside. So if you're going to be at noon, you do want to use the sun protection.
Great. Dr. Hamish, thank you so much. Dr. Kirschner, what are the latest developments in wound healing?
Thank you, Tony. So we are very lucky in our department because we have probably the top department in wound healing, regardless of specialty in the US. And if you go to a pharmacy and look at wound healing products, or go to clinics throughout the United States, many of the products, if not most of the products, have been studied in our department. But one of the things that's very exciting is the development of what we call skin substitutes or artificial skin. These are products that are grown in the lab and then can be applied to patients' wounds to stimulate healing. The benefit of those is that you don't have to take the patient's own skin like a skin graft. You don't have to harvest their own skin and saves the wound of a donor site. The problem is that they don't necessarily take, because they're not the patient's own skin, they're cells from a different donor. So in our department, we're currently in our labs trying to investigate ways to take the cells that are abnormal around the wound, because a wound is a consequence of disease in that area. And we could take those cells and genetically modify them and create healthy cells and a healthy piece of skin from those abnormal cells around the wound. So that's a very exciting advance to alter the cells that are abnormal and make them normal. We're also studying stem cells, and not just pure stem cells, but what we've learned, and scientists in our department have learned, is that stem cells produce a protein, and it's that protein, which is called an exosome, that does the business of stem cells for healing and rejuvenation. So you don't even need the cells anymore. You have those products that the cells produce, and they can be applied to wounds to help them heal faster and help them heal better. So there's tremendous amount of excitement about this in the wound healing world.
And Dr. Kirschner, we're going to keep you here because this question was just submitted. It goes like this: my dermatologist has removed my basal cell carcinoma using Mohs surgery procedures. What method does the University of Miami use for skin surgery? Is the Mohs method still considered a preferred approach to remove cancer cells from the skin, or are there other surgical protocols that are preferred?
Well, thanks again for that question. And I think that the most important thing is we tailor the treatment to the patient and to the patient's skin cancer and their other medical problems. So while Mohs is a great treatment to remove certain cancers in certain locations in sensitive areas, locations that have cancers that have recurred, we have an armamentarium of things we can use. And I'd like to hand this to Dr. Tang, because she's really one of the people that does a lot of the skin cancer work. And I'd like her to comment on the idea of Mohs and other techniques to get rid of skin cancer.
And thank you, Dr. Kirschner. So absolutely. So Mohs micrographic surgery is named after a surgeon from the University of Wisconsin, Madison, named Frederick Mohs, who developed this technique of using cryo surgery, essentially, where we're able to, in office, remove skin cancer and do 100% margin control, meaning we can look at all the side margins and the deep margins, and it's all mapped out and color coded so that we are very precise in removing additional tumor without removing unnecessary normal tissue, so that we can give the patient the smallest wound and therefore the best scar we can offer. That being said, it's not a technique that's used on every skin cancer nor on every patient. There are criteria that we utilize to where it's deemed appropriate or not, and it's typically for areas that are higher risk, mostly in the head and neck. And then, depending on the tumor, whether it's large or recurrent, we do utilize Mohs surgery off the head and neck as well. And for the most part, I think the argument of where to draw surgery, the line to draw surgery, that's definitely, it's a very, it's a tough question to answer, because we'd have, 90-year-olds these days that have great, survival, and it's hard to estimate kind of where to draw the line of when to treat surgically. That being said, it is, the most cost-effective way if it is surgically amenable. But we definitely take it on a case-by-case basis, and we do incorporate, what patients' preferences when moving forward with Mohs surgery or not.
Tony, if I could, I just want to add one thing, because we've had some advances in our department. Many people get multiple skin cancers, and our clinicians have been looking at the use of a vaccine. We hear a lot about vaccines for COVID and such, but this is a vaccine that's already available. It's the wart vaccine against human papillomavirus that prevents genital warts and cervical cancer. But we have some experience using it as a prevention for people who get multiple skin cancers to reduce the occurrence of more skin cancers. And so far, the data is very positive. It looks like there's something there, and there's a fair bit of science behind the idea of vaccination against human papillomavirus as a technique to reduce the burden of skin cancer in patients.
Thank you both. Fascinating. Dr. Tang, can viruses lead to skin cancer?
It's a great question, Tony, especially in the climate of coronavirus these days. But there are other viruses that affect us. So that absolutely. So there are certain lymphomas that are caused by viruses. There's another tumor called Merkel cell carcinoma that has a specific virus called the polyoma virus that can be seen in up to 80% of those tumors. And then, as Dr. Kirschner was mentioning, the human papilloma virus has also been implicated in squamous cell carcinoma. The incidence of that ranges depending on whether an individual is immunocompetent, meaning having a normal immune system, versus having a suppressed immune system. So in the immunocompetent patients, it's been seen in about 50% of all squamous cell carcinomas, and then the immunosuppressed upwards to 90%. And it's not all wart viruses. There are hundreds of serotypes that can affect humans. There are benign types, which cause warts, and then there are malignant ones that can undergo transformation and lead to skin cancer. We still don't know enough about it. We know that it exists in the tumor, but we don't know the relationship, whether it's causative, meaning there's a direct causation, or whether it's commensal, merely it's just living there and not truly causing carcinogenesis. And Dr. Kirschner and one of our brilliant colleagues, Dr. Nichols, has done a lot of work in this area, the HPV vaccine, which has historically been known to help prevent warts and cancer, have been utilized to treat skin cancer as well. And it's a very novel technique to treat skin cancers that perhaps may not be resectable, or someone that's not able to tolerate surgery. And it's a form of immunotherapy per se. And Dr. Nichols and I are interested in pursuing other avenues of how to use the wart vaccine, whether alone or in conjunction with immunotherapy, to augment the response of our innate, of our own immune system to fight off skin cancer.
Dr. Tang, thank you so much. Dr. Jaimes, my mother had melanoma. Any recommendation for me and my children to protect ourselves?
Well, again, important that some protection and family members, especially first degree members, should also be seen by dermatologists, especially if they have a lot of moles. And as we already said, check their skin once a month and be enrolled with the dermatologist so that we can do full body skin checks to family members of melanoma, since we know that family history, especially of melanoma, is also a risk factor. So basically very easy to remember. Check your skin and both with the dermatologist and at home.
Dr. Jaimes, thank you so much. Dr. Hu, when should a person start using retinol for anti-aging?
Okay, great question. So retinol, just for people who don't know a lot about retinol, it's a topical ingredient similar to vitamin A. It's considered almost like a gold standard in topical anti-aging in the sense that it helps our cells to differentiate and to have a better turnover. It stimulates collagen. It helps us to reverse and repair some external environmental sun damage, or also known as oxidative stress. So ideally, we should start using a topical retinol in our 20s because studies have shown that we start experiencing intrinsic and extrinsic, so internal and external aging starting in our 20s. But then that being said, if you don't use sunscreen, if you're gonna go use tanning bed, it doesn't matter when you start retinol. So really the basics is sunscreen, have a good, healthy, some protective behavior, and then we can talk about aging.
All right, Dr. Hu, thank you. But we're going to keep you here because we just had this question sent to us. For physical sunscreen, it starts like clothing and hats and sunglasses. Will any clothing work, or do you have to use clothing that has the UPF ratings?
Okay, so ideally, if you are looking for true sun protective clothing, you should look for labels as UPF, that stands for UV protective factor. Typically, there are 50 plus. So there are a few really good brands out there, Coolie Bar, Columbia. There are reputable brands that actually make sun protective clothing. I love sun hats with either impregnated material that helps to block block UV, or sometimes the fabric is special weave that gives you additional protection. So sunscreen is good, but it's not 100%. We're gonna be out on the water, sailing or boating, wear long sleeve UPF clothing will give you that extra peace of mind.
Great. Dr. Hu, thank you. Dr. Mandy, do I need fillers or Botox?
There we go. That's the most common question we get in cosmetic work. And the answer is you may need one or the other because they work differently. Botox works on what we call dynamic wrinkles. That means the wrinkles that occur when you make a facial expression. But Botox can't be used very readily in certain dynamic wrinkles. For instance, you're making a little bit of a lower face expression, which if we use Botox might cause you to drool or do things that wouldn't be pleasant. But we use fillers to replace volume or to fill areas where you have wrinkles that are made either dynamically or by static wrinkles, which are due to basically skeletal loss. And as we age, we lose our skeleton, and that causes skin to fold on itself. So we can replace the volume. We can't replace the bone, but we can replace the volume that's lost by using a filler. Most patients who come in for cosmetic work, especially people over, say, 35 or 40, wind up using both products. They use a neurotoxin like Botox to relax the muscles, and then they use filler to fill the volume loss.
Thank you, Dr. Manning. We're going to keep you here because we just had this one sent in. Does collagen help to rejuvenate the skin? And if so, what's the best form? Is it pill or cream?
Well, actually, collagen, if you took it by pill, would be digested and wouldn't be collagen anymore, because collagen is made up of a series of amino acids that your stomach and enzymes would digest. Collagen does not penetrate the skin when applied to the surface of the skin. So truthfully, the only way to have collagen is either to use a medication such as a retinoid, which Dr. Hu was talking about, which helps you make collagen, or to inject things which make you make collagen. And there are certain fillers such as polyl-lactic acid and calcium hydroxyapatite, which if you inject will cause your body to make new collagen. But you can't just rub collagen on and get it through the skin.
And Dr. Mandy, thank you. Dr. Jaimes, this one just sent in. Herceptin, Perjeta, and radiation cause unbearable itching affecting quality of life. Prescription and non-prescriptive ointments or antihistamines just don't seem to work. I believe it is a problem related to inflammation. Is anyone doing any research, or does anyone have any answers other than telling patients not much can be done until chemo is completed? Patients suffer tremendously with constant itching not solved by medication during chemo. Is anyone looking for answers and the relief for us?
So I think it's patient asked to the exact place where a lot of itch research is going on, and we have our colleague Dr. Josipovich, which focuses clinical, and his research interest is itch basically, and is world renowned. So there are more things than just saying nothing works. And for sure also, if radiation, there are many things that we can do before starting radiation, or even the treatments. There are things that we can do before the patient gets in the treatment, during and after. But yes, there are many things that can be done, moisturizing the skin, and obviously medications that can be taken orally by mouth. But yes, there are things, and more than just saying that nothing can be done. For sure, this is the great place to be.
Thank you, Dr. Jaimes. Dr. Kirschner, does every patient with allergic contact dermatitis need a patch test?
Thank you for the question. It's a good question, and the simple answer is not. The simple answer is no. Not everybody needs a patch test. Typically, we patch test people who's unresponsive to simple therapies like topical treatments, if they don't get better, or if their allergic contact dermatitis returns. So if they have recurrent or refractory allergic contact dermatitis, then it's worthwhile going through the efforts of finding out what they're allergic to so that they can avoid it. And patch testing is a great technology, but it doesn't always give the answer that you're hoping for. You're hoping to find an allergen that you're allergic to and you can avoid it. But while we test to tens or even hundreds of allergens, there are thousands of allergens out there. And sometimes we don't test to every single allergen and we may miss it. Or you may be allergic to something and that's not the culprit. You're allergic to cement, but you're not coming in contact with cement. It's not causing your problems. So while patch testing is one of our tools, interpreting the results are really very important as you manage a patient with difficult contact dermatitis.
Thank you, Dr. Kirschner. Dr. Hu, this one just sent in as well. What are your best dietary recommendations for healthy, youthful skin?
Oh, I love that because nutraceutical is definitely something that we're interested. We're looking beyond treatment. We're looking at prevention. So even though the data is very hard to find evidence-based studies supporting nutraceuticals, just because it's very difficult to have a double-blinded randomized trial, especially on nutraceuticals. So that being said, based on what we know in the current literature, based on also safety and efficacy, what I like to recommend to my patients are typically vitamin C, because vitamin C is a cofactor for collagen production. CoQ10, another cofactor necessary for collagen production, is also a very good antioxidant for heart health. I also like to recommend something called HelioCare, which is actually derived from a Brazilian fern plant, has really good data, medical data in helping people to add a little bit extra SPF against sun damage. And then lastly, instead of focusing on supplements, try to focusing on other aspects of your life. Healthy diet that has a lot of greens, plant-based diet, ideally exercise, because we know that exercise actually helps to slow down aging by reducing what we call glycation products and advanced glycation products, which means sugar added to our protein that makes our body more inflammatory, that breaks down collagen faster. So exercise, healthy diet, supplements like vitamin C, CoQ10, and SPF protective factor from HelioCare.
Dr.
May
Who?
I add one quick addition to that? I think niacinamide, vitamin B3, has been shown to be not only cancer preventive with skin cancer, but also is very important in glycolation and in general health. And it's a very good supplement that you can take in the form of either niacinamide or nicotinamide. They're all derivatives of vitamin B3.
Doctors, thank you. In fact, we're gonna throw this one out to the team because it just came in to us. Are there any advances to getting rid of cellulite? And please, all of you can weigh in if you'd like.
Well, there are a lot of options, a lot of gimmicks out there. First of all, topical medication where treatments do not work for cellulite. I just want to put it out there. So in our clinics, what I like to do is a combination of microneedling and injecting the biostimulator Dr. Mandy mentioned before, the poly-L-lactic acid. We have had really good results. So that's really a good combination. Microneedling to resurface the top layer, and then injecting biostimulator to help not only breaking up the bands that hold the skin down, but also stimulate collagen to fill in the dimples.
And one more thing also, so it's not in the market yet, but there's a product called collagenase, meaning it's an enzyme that breaks down collagen, which are the bands that tether the fat, which cause dimpling in cellulite. And it's a treatment that's been used in the Dupuytren's contracture, which is like the tightening band on the hands, which is very common. But that's, hopefully soon to be on the market.
Dr. Mandy or Dr. Kirschner, would you like to weigh in on this? I was just going to mention what was just mentioned about the collagenase. The data is good, but not fabulous. I don't know that the cure for cellulite is out there yet, but I agree with Dr. Hu that the use of sculpture on the right patient works very well.
Dr. Kirschner?
No, but I would mention that I think Dr. Mandy mentioned the idea that the treatment's not there yet. And I think that's one of the things that is special about an academic dermatology department, is that while many people will look at a problem and say there's not an answer, we look at a problem and we look for a solution to that problem. So each challenge represents an opportunity to not only help the patients that we see on a daily basis, but help patients throughout the country and the world with our discoveries and innovation.
And Dr. Jaimes?
Well, I just will add up, besides the healthy diet, exercise. So that's also not only, we need to keep it up. So with the exercise.
Thank you, Doctor. It always comes back to exercise, doesn't it? It really does. Dr. Kirschner, is eczema a permanent skin condition, or can it go away? And can it come on with stress?
Right. So eczema is a kind of a wastebasket term for a lot of inflammation of the skin. But at the same time, it's been used as a synonym for something called atopic dermatitis, which is a condition that generally starts in childhood. And the large percentage of those people with atopic dermatitis also referred to as eczema get better with time. Some of them continue on in their lifetime, but throughout their life, but many of them get better. So you don't have to have eczema your whole life, even if you have it for the first 10 or 20 or 30 years of your life. It could get better and go away. Or you could develop it later and it continue on. The good news is that there are new treatments being developed specifically for that disease that have really transformed people's lives. Because as we learn more about why eczema occurs, the mechanisms of actions, the molecular and genetic patterns, we can target therapies for that. And yes, stress has physiologic effects, and stress can make eczema worse. And I think people during this time, this pandemic, and all the challenges we're all experiencing, we're seeing a flurry of people who have present with eczema or are having flares of their eczema that they didn't have before. So it is a challenging time, but thankfully we have some treatment options that can make their lives better, as perhaps as we wait for them to outgrow it, hopefully.
I don't know how this hour's flown by. It's been absolutely amazing. We want to thank all of our panelists who have helped us explore this groundbreaking research and all these efforts in skin health and skin cures. And that was our last question of the evening. But before we close this town hall tonight, I really would like to ask Dr. Kirschner, Doctor, your final thoughts on all of this and your colleagues that were with us tonight, and all of the questions that were submitted and all of the great work that you're doing at the University of Miami.
Well, thank you, Tony. And I want to thank the people that are listening because they really inspire us to do what we do. I want to thank you for moderating this session. And I want to thank all my colleagues on the panel tonight. They represent the best that dermatology has to offer in the United States and worldwide. And it's not just the people here, but everyone in our department. And I think what really distinguishes our group of physicians is that while we care exquisitely about the individual patient in front of us, we also want to make an impact beyond the walls of our own clinics through teaching, through education like we're doing now, through contributing to the scientific literature and making discoveries together as a team with other clinicians and with our physician scientists. We really want to change people's lives. And we have a partnership with the community. And part of that partnership is we try to develop innovation and discoveries to make people's lives better. And sometimes people in the community are able to support our work with philanthropy. And the work and the support that we get from our donors really enables us to do the things we want to do and to help and advance the care of skin disease that you can see that we're so passionate about. I think it was evident on the panel tonight, each of our own expertise and coming together as a team. So I want to thank you once again. I want to thank the Board of Trustees for supporting us. I want to thank the school administration and the university for supporting us. I want to thank all my colleagues. I want to thank all the donors and the people who have supported us in the past for what they've done for us. And just know that every day we go out to do our best for each of them and for the community at large. So thank you very much, Tony. Really great to be here and really had a fun time tonight. It's great to talk about our favorite subject, the skin.
You could tell, Doctor, and we were sort of saying in jest, but it's the truth, because tonight basically was the Mount Rushmore of dermatology, listening to all of these doctors. Thank you, Dr. Kirschner, and thank all of you for participating in tonight's In the Know Town Hall. Again, kind of echoing Dr. Kirschner's words, I think we learned valuable and insightful information tonight, especially in light of where we live, work, and raise our family in South Florida. What did we learn? How important all of these things are that we need to do to take care of our skin, whether it's sunscreen, exercise, diet, all of these issues. As alums and supporters of the University of Miami, we should all be so proud of this group of dedicated and skilled doctors who, quite frankly, are here to serve and to educate. Please remember that a full recording of this program will be posted online. Look for the link in the coming days. And if you would like to give to the Dr. Philip Frost Department of Dermatology and Cutaneous Surgery or the Sylvester Comprehensive Cancer Center, we will have those details for you in an email tomorrow. Now, in a moment, you will see a survey about tonight's town hall on your screen. Please take a minute to submit your feedback. And quite frankly, I've taken the survey. It doesn't take a minute. It takes about 30 seconds. It's important to us because what it will do is help us understand your interest and improve our program. And as always, we wish you and your family good health. Stay safe. Have a very safe and a very happy Thanksgiving. And remember, from all of us to all of you, it's always about the you. Good night.